Hi guys. So I'm talking all things communication with the pediatric population. I want to start off by saying that everything we do is communication. Everything is communication, and communication is everything, right? It's especially with kids. Everything is communication. I also want to put out a concept that all behavior is a form of communication. Sometimes it's not the most successful form of communication, but it is communication. And so when we're working with kids, I start my communication process, and I would encourage you guys to start your communication process before they even arrive, okay? So I know we all love online booking. That's awesome. But I'll actually call a parent, I'll talk to a parent, and I explain that when your kid comes for massage, it's not going to look like what you expect. It's not the same as you going to a spa, fluffing your way through consent. Yeah, I get it. I just want to get on the table, right? It's not that. And then you get on the table and you're there for, depending on your therapist, 50 minutes, an hour, and you get off and you're nice and relaxed. That's not the kid clients I deal with at all. So I tell parents right from the get-go, that massage is it's probably not going to be the case. Some kids, yes, but I might do a lot of back and forth with the kid. It might be 50% communication and 50 hands-on, right? I might be sitting down on the floor with them, chatting, and then a little bit of table work. So warning them ahead creates that idea, that picture, that image they have of that very rigid massage therapy appointment, that it doesn't exist when you're working with a kid. I also let them know that if I show up at your house, if the kid tolerates it for 5 minutes or 10 minutes or half an hour, I still bill for the full hour. Because I'm doing a home visit, it's taking my time, I booked the time, and it is what it is. However, I'm not saving lives, so your kid gets to choose. They get to give consent. I'm not pushing my hands on a kid. I'm touching them. I'm communicating with them. So that information ahead of time is key. It's key to parents understanding what they're getting into. It's key to understanding what the expectation is. I give kids an opportunity to have a quick Zoom meeting with me so they can see my face, so they can chat with me, so they can ask questions, so I can ask them questions, they can get familiar. That's before the treatment even starts. Once they come to the office, how many people here know what transition is? Transition in time, in activity. Yeah, okay. I see one or two. So transition is a change in space. So when a child or an adult goes from one location to another, whether they're going from one activity in the same space or when they're going from one thinking spot to a different thought process. That's all transition. Transition is difficult for kids. So providing space and time for transition for kids is also key, and it's part of communication. Transition in a kid's world is getting up in the morning, going to school, leaving school, going to my office. That's all transition. And then there's a whole bunch of tiny transitions throughout the day. So giving time for that is key. It's really important. Once they arrive in your environment is communicating to them. If you have that funky little fountain in the corner over there, or that cute little figurine over there that's breakable, and they see it, they're going to zone in. They're going to walk up to it. They're going to want to play with it. And if the other adult, whether it's me, whether it's you guys, whether it's the parents, say, don't touch that, guess what's going to happen? Two things. One, that is going to be their entire focus for the whole time they're there, because nothing drives focus more than don't stop that, right? The other thing that's going to happen is we've communicated to them that our space is not really about them, right? So there's quick little things we can do. We can pull that fountain out if it's little, that little figurine, move it out, put a couple things for the kid. During consent, communication is key. Breaking things down into the tiny chunks, right? I'm super over the top about it. Like I said, you can take off as much or as little as you want. Like you can leave all your clothes on because I got some great things I can do with your clothes on. You can just take off your socks if you want, right? And make sure the adult with them is on board with that. Because there's nothing worse than a parent as you're at the door going, okay, get undressed. And then I got to back it up. I got to move back into the space, right? And say, let's sit down and let's talk about this again. Because the lessons we learn in a massage room can be transferable to the rest of the world, right? That's communication. Chunking things down into smaller bits for them to understand, that's communication. Everything we do, we want them to understand that we are adapting to them and we're not expecting it the other way around, right? We're communicating through our actions, our words, and our touch. Okay? Then on the table, in your clinic, in my clinic, if you decide to work with kids, there's so much back and forth. I've worked with kids where I have consent in the beginning, and then I'll demonstrate a technique on the table or on my arm. Do you want to try this one? Where are we going to try it? We're going to try it on your arm. We're going to try it on your leg. And they'll give me an arm. I'll do a little bit, only to have it pulled away, and then a leg thrust at me, right? This is all consent. This is all communication when we're dealing with kids. And so that standard treatment where you treat a leg, you treat another leg, and then some arms, it doesn't exist in my practice. If you work with kids, it might not exist in yours. I've had kids, was teaching a pediatric massage course, and I told the student therapist, get them to circle the areas they want work done. And the therapist said, okay, they brought me this picture. And the picture was like the left leg and the right arm and two hands. That's it. And the therapist said, what do I do? And I said, that's what you have consent for. Do that. And check in throughout. That's consent. With a kid, it's different. So it's a lot of back and forth throughout the massage. It's good to know I think of a good way to say this, what communication skills a child has, whether it's cognitive, whether it's social, whether it's actual expressive language, which is what can they get out? What can they process and get out? Or what receptive skills they have. We talk about developmental stages with age attached, and I would ask you to try to think about it outside age, because if you say to a parent, what age of communication are they at? That could be somewhat insulting, right? And it could be insulting because maybe they have a 10-year-old and theoretically their communication skills are that of a 5-year-old. And so focus on skill. Focus on how does your child communicate? Focus on what skills does your child have? What needs do they have, right? Instead of what developmental stage are they at, right? Because the way you ask questions, the language you use is also communication, right? Yeah. So knowing where they are, what skills they have is very important. I also want to touch a little bit on literal thinking in children, particularly if you're working with children on the autism spectrum. They might be extremely literal. So again, I'll tell you a story about teaching a massage therapy class about working with children. And I said, be extremely literal. Mean what you say and say what you mean. And this student says to the kid on the table, so have you had enough? And guess what the kid said? No. And so the therapist was like, what do I do? I said, well, you keep going. You asked a question, you expected a response, they gave you a response. Follow through. What you say is what you mean, right? So next time, say, we have 5 more minutes, or we have 2 more minutes, and then we're going to get off the table. Communication is everything, and everything is communication. So that was fun. And I just have a couple more minutes. So I want to emphasize the idea that you're getting consent from a kid, really communicating well with a kid is so crucial, because a lot of the population that I work with are kids with communication challenges, kids with cognitive, motor functioning conditions, children with health conditions, and those populations in general tend to be talked to or talked over, talked about, talked through, and they're not given the time, the consideration to really communicate, right? To communicate in the way that makes sense to them, whether it's with pictures, pointing, looking, communication devices. And so what I'm going to say to finish this off is slow down when you're working with kids. Be respectful of how they communicate. Don't be so stressed out about getting them on the table. Think about what you're demonstrating, and remember that communication is everything, and everything that you do is communication, especially when it comes to kids. I think my time is up. No? I thought I got a couple minute warning there. So,
you have a full 20 minutes, so technically you can keep going if you like.
Oh, okay. I think there was more, but it's gone from my head now. So I run a few, what I will say is a shameless plug. I run a few courses related to the pediatric population, a communication course, a full 3-day course that is as many things pediatric population as we can get into, a therapeutic exercise course, which I'm going to be doing a demo in the other room, sensory focused, and I'm sure there's something else. Oh, creating a sensory friendly and autism friendly clinic environment is also another thing. And the last thing I want to say is when children are not listened to, particularly kids with communication challenges, you might get extreme forms of communication, right? Dropping to the floor, screaming, running. So take your time, communicate, and take in everything they have to offer you. And yeah, that's what I got to say for today.